Most of the time the fetus would come completely out before he either cut the spinal cord or he introduced one of the instruments into the soft spot of the fetus. He would leave a patient on a table 45 minutes with her legs open with a speculum inside her cervix as he went across to his office and had his sandwich.
I'm sorry to say, but I'm not gonna work on you, and yes, there is a chance that you can die from this, but I'm not gonna work on you at all unless you come up with $250.
He would hold the fetus by the feet and kind of pull down and insert the claws, and when he would squeeze them, you can see that baby's toes spread open.
And if he had a patient that asked a lot of questions, he'll prefer for them to be put to sleep.
Yeah.
And then he said that if I tried anything funny or if I didn't pay, he was gonna have his wife kick my ass.
On some occasions, we had women that were, the fetus were falling into the toilet.
I got home and I took my coat off. When I took my coat off, I felt like a little pain, and they had left the IV inside my arm.
The fetus opened his eyes and actually
Grabbed his finger.
was able to grab his finger. I think the oldest procedure I'd done was right at 28 weeks. A lot of the times we would bring the big fetus that were over age, and we would reopen the bag and just look at it and be like, oh my God.
There was a knife laying on my bed. It was like stand up like this on the bed.
You could tell that the stomach was still up, and he'd start feeling, and he'd realize there was another fetus. And the patient had no idea that she had twins.
Hello, I'm Mark Crutcher.
And I'm Renee Hobbs. Most of you are probably familiar with the recent conviction of Pennsylvania abortionist Kermit Gosnell. He was sentenced to life in prison for the brutal murders of babies who were born alive following abortions that he botched. Since then, the American abortion lobby has been frantically trying to distance itself from Gosnell by claiming that he was a one-time aberration and that such horrors are not occurring elsewhere. But as you are about to see, that is not true. The fact is, these sort of things have been going on for years at abortion clinics all across the country, and they continue to go on today.
In early May, we produced a YouTube video of an interview Renee and I did with 3 former employees of Houston abortionist Douglas Karpen. In part 1 of this DVD, you can watch that 14-minute video and hear these women testify that they personally witnessed, and in some cases participated in, the same sort of things that Gosnell was doing. And we warn you, it's not pretty. Be prepared to hear about unimaginable acts of violence in which babies born alive after botched abortions are then killed. Then in part 2, the interview continues with details about how the women who come to these facilities are treated. And as you will see, what's done to them is almost as shocking as what's done to their babies. Finally, part 3 is an interview we did with an actual patient of this particular abortion clinic. And it's going to challenge everything you've ever been told about so-called safe and legal abortion.
The most important thing for you to understand is that the behavior described in this video is not unusual. At Life Dynamics, we routinely interact with post-abortive women, and we can assure you that, contrary to what the pro-choice community claims, this is everyday life inside America's abortion industry.
I was an OR assistant. I did a lot of parts of the clinic, and one of my jobs was his right chair assistant. And I never paid attention. I did pay attention, but I didn't know that it was illegal. When he did an abortion, especially a over 20-week abortion, most of the time the fetus would come completely out before he either cut the spinal cord or he introduced one of the instruments into the soft spot of the fetus in order to kill the fetus. But I wasn't aware. I thought, well, it's an abortion. That's what he does. But I wasn't aware that it was illegal. And on many occasions, we had fetus that he would use the process as far as what is it called, where he would dilate the cervix and then dilate the cervix, evacuate the uterus. And most of the time we would see him where the fetus would come completely out, and of course the fetus would still be alive because it was still moving, and you could see, of course, you could see the stomach breathing, and that's when he would do his, he would snip the spine, as they're saying, that this doctor did, and of course the soft spot was one of the spots that he would take one of the forceps, or the, what is it called, the dilators, and stick it down the soft spot of the fetus's head.
You saw this happen?
Oh yes, I think every morning I saw on several occasions. If we had 20-something patients, of course, maybe 10 or 12 or 13 or 15 patients would be large procedures, and out of those large procedures, I'm pretty sure I was seeing at least 3 to 4 fetus that were completely delivered in some way or another, because sometimes laminaria causes the cervix to get so soft that you don't need a lot of pulling or anything on it. Once you take that package out, 9 times out of 10, that fetus is ready kind of just to flow from inside of the uterus out into,
When you say package, you mean the laminaria?
The laminaria package insertion, yes,
Right.
sir.
You take that out and the baby's ready to come out.
Yes, sir. As soon as that, or sometimes he would go ahead and bust the water sac, and there you go. You practically had a fetus, in the pan. So.
And you see the baby alive,
Yes, sir.
and him kill that baby outside the womb.
Yes, sir.
And this would be done by jamming some sort of instrument into the
Either that or
soft spot,
or twisting the head off the neck, kind of with his own bare hands.
And you saw that happen.
Yes, sir.
So he would twist the head off. I'm sorry.
Sometimes he would go through the stomach as well.
Sometimes he would do what?
He would force it through the stomach.
The instrument, is it beards?
And twist it.
Yeah.
And you saw that?
Anything that he could get to the fastest, like she said, the umbilical, he was probably perforating the umbilical cord. I normally saw either the snipping of the spine or the introduction of the instrument in the soft spot of the fetus normally, or twisting of the neck.
I remember he would put his finger.
Yeah, or his finger. He'd take his finger and then
through the throat.
Yeah. You remember that the one that he did, that the baby, the fetus came out and it was alive. He thought he had actually killed it already, and he opened up his eyes and grabbed his hand, his finger. Remember that one?
No. What happened?
Supposedly they said that it was a botch, and it was a botched abortion. The fetus was still alive. He thought it was dead, and the fetus opened his eyes and actually
Grabbed his finger.
Was able to grab his finger. And the whole procedure, I guess, while he's doing the procedure,
He was getting
because after the fetus, of course, he has to massage the abdomen to bring the placenta down, or grab it with the forceps to bring it out.
And this baby was killed
alive.
how? Huh?
He was alive.
Well, yeah, if he's looking at him grabbing his finger.
Yeah.
Yeah. He thought he had finished with the baby.
He thought it was deceased
It
already.
was a disease already. He was getting ready to put it in the bag.
Did he talk about that?
One of his employees did. That's how I found out.
He doesn't talk about that. He doesn't make any comments about it.
How did he kill that baby? Do you know?
We found out about it through another employee. I don't think that was said how he killed it. I'm not sure. That must have been a big abortion, though, I believe. Can't really recall, but I know that he does a lot of huge abortions. A lot of the times we would bring the big fetus that were over age, and we would reopen the bag and just look at it and be like, oh my God, it's so big. We would be amazed how big it was. And we'd be sweating and stuff, because it'd take us almost an hour to perform an abortion that big. It's really hard when you only get doing an abortion that big and only dilating with maybe 13 to 14 laminarias in the cervix. It's kind of hard. Sometimes he couldn't get the fetus out. He would yank pieces, piece by piece, when they were over the size. And I'm talking about the whole floor dirty. I'm talking about me drenched in blood. We had several occasions that where women would come in and they would actually be going in labor because that overnight insertion, the package, he might have gone a little bit too far, would put in too many in there, and Some women had started to cramp, and sometimes they would get to the clinic and they would make it to the OR room because they're in a line, and you know, when they get there, they give them these pills called Cytotec, and they put them in your gums. And it takes, I'm thinking it takes about an hour before you get a full effect, and that makes your uterus start contracting. And so a lot of, we've seen a lot of cases where women would have to, they felt like they had to push and they had to run to the bathroom and stuff. And on some occasions we had women that were, the fetus were falling into the toilet, or they were, or before even getting to the clinic. We had one incident where it was big news, where the fetus was left in the toilet. I don't know if y'all heard of that one. She was at McDonald's. They stopped there in the morning and the fetus was left in the toilet, and nobody ever found out whose fetus it was, but it was one of his patients. We knew it because we were watching it on the news that day that she was supposed to be in the clinic.
Do you remember that one that she was on her way to the OR, Crystal? And she was walking to her OR and she had it right there in the hallway.
She had her baby in the hallway.
Yes.
And what happened to that baby?
I wasn't down there when that happened. Were you down there?
He just picked it up with like a pad, one of those
Chucks.
a chuck, and just put it in a trash bag.
On some occasions, of course, he pulled out a lot of breech fetus, and their toes would be moving. You know, you can see the fetus toes moving, and as he would insert the forceps, what are they called? The beards. There's two types. There's the beards, and then there's the sophers. The beards are the ones with the bigger claws, and that's the one he would use to yank the fetus out. And I remember, I have a visual all the time. I always remember this. It's real disturbing to me, where he used to clamp, like push it in. He would hold the fetus by the feet and kind of pull down and insert the claws. And when he would squeeze them, you can see that baby's toes spread open. And I would always say, oh my goodness, you know, and people say that that they don't feel. Well, if they didn't feel, why would their toes, you know, their toes would be out hanging kind of like in a, what's going on, you know, where am I going? And I remember clearly every time he used to use that instrument, I remember those little toes, you know, opening wide. It was a sad picture. I normally would turn around, kind of just hold and, you know, just turn around until he was finished. And he would do abortions way over 24 weeks. I mean, there's a big difference in a 24-week fetus, and every week from 24 on up, that 1 week is such a big difference. I'm talking about big fetus. I'm talking about being in the OR about an hour trying to do one procedure that big. I'm talking about being really tired after this procedure from where he could not get this fetus out, you know, and it's very overwhelming. We used to look at each other, and sometimes our tears would come out, you know, with the other assistants. Our tears would come out because we would say to ourselves, why? We would always think he's so greedy, you know, and we were not talking about normal price. I'm talking about $4,000, $5,000 for a procedure this big.
As long as the patients had the cash, he was going to do it past the 25 weeks.
Yeah.
Did you ever assist like?
Yes, I did.
You did? Mm-hmm. What kind of experiences did you have?
The same thing she did is the same thing I did. I would tell Deborah all the time, Deborah, I don't want to go in there, I don't want to go in there. And he would tell me, like, you can do it, you can do it. If you feel like you just can't look at it, just turn your face.
He wanted me in the phone room because I've always been pretty good at appointments and, you know, talking to people and convincing them to come to the clinic. I just knew my way, you know, as far as talking to patients, being real good convincing patients to make appointments. And so that's when he threw her in the back office, which was OR, sterilization, you know, things like that. I mean, there's a lot of things. I mean, from these large abortions, these botched abortions that he was doing, to hurting the patients on the table, to causing some kind of major problem with the woman's, you know, ripping a uterus and not letting the patients know, trying to stitch them back together and send them home with the package of gauze, and then they come back tomorrow so you could pull it out, but never telling the woman, you know, hey, I ripped your cervix. you need to get some kind of, some kind of special, you need to get that looked at, He would never tell the woman.
And if he had a patient that asked a lot of questions, he'll prefer for them to be put to sleep.
Yeah.
Oh, really?
Yes.
Any little comment that you would make as far as if he were on the table, it was his way of making more money, of course, because deep sedation meant dishing out another $200. So if you made, is it going to hurt? I mean, this man would walk out the room and say, Deborah, go talk to her, tell her she needs to get put to sleep. And normally it was our job to go convince the girl that she had to get put to sleep. And a lot of them would raise a lot of hell.
Right.
But they didn't have no choice. They had to do what he said, because guess what? You're going to lose $150. In other words, that was $150 that you did not get back. So a lot of them would either lose the $150 or pay the $200 and go ahead and get it over with.
So other employees besides just Deborah and Crystal knew that these sort of things were going on.
Oh,
Yeah.
Everybody there.
Everybody knows.
Everybody-
It's an open book.
The women that go there have no idea what they're getting themselves into. A lot of the questions have been, does the baby feel? And I think that would make me so mad, because I would say, why would that matter to you if you're coming in here to kill your baby? Why ask that question? And of course you would want to say, yeah, it feels, but that wasn't your job to say that. Your job was to, whatever it took to get that person in the back,
Were you ever instructed to deceive women? If women said this, don't tell them the answer to that. Tell them this over here. Were you ever told to overtly deceive the woman?
Oh yeah, that was an everyday.
We did
And
that
so what
every
kind of
day.
things would you deceive her about?
Yeah, depends.
They asked a lot of questions. A lot of people wanted to know about their due dates, and they wanted to know why is it that a lot of them, there were 16 weeks at this doctor's, but 18 week, one of our answers was, ultrasounds are all different, and the way the machine measures, it could be different from that doctor's office. Let me see what else. He would up the price, like they'd ask, why is it more money? And you would have to kind of put your own input in it. Oh, because it's a bigger procedure, or you're heavy set. It was just, there's a lot of stuff that, I can't really remember. I know I remember all the crazy things that you say to people, but there's a lot of stuff that I am guilty for lying to a lot of patients on the phone and in person.
Did you ever have situations where a patient comes in, you do an intake form, you assume you charge her up front, she sits in the waiting room, then changes her mind?
She doesn't get all the money back.
She don't get her money back.
How much does she get back?
Sometimes nothing. It wasn't his fault. It was your fault.
He wouldn't give them the cash back that same day. He would tell them they would
They
have
had
to
to
come
wait.
back.
Even if he was going to give it back to him, he wouldn't give it to him that day?
Right.
Like say you were to pay like $200, and she said, you know what, I don't want to do it no more. He would tell her, well, she can't get her money back today. She has to come back tomorrow.
Another day.
And then they would give her so much hell when she'd come get
Runarounds.
so much runarounds just to get her money back. 9 times out of 10, of course, you wouldn't get back 150. There was no, are you sure this is what you want to do? There's other options. That was never seen in our clinic.
No.
You push in a video, you let them watch the video, and you ask them, does anybody have any questions? And if you think you can't handle the procedure, you can get put to sleep. That was the counseling. There was no other options. You didn't ask.
Sometimes
were they sure?
sometimes there was not even a point of asking. Who's next?
Yeah.
It's just who's got the money.
Yeah.
Yeah.
And the way of him interviewing a patient is, have you took any antibiotics for the last month, or do you have any medical problems? Make sure you have a driver, and see you tomorrow.
That's
his counseling.
That's his counseling.
And the reason that I know that, because I go in there.
What you're saying is basically there was no counseling.
Exactly. There's no counseling at all. No.
Do you have the money? Do you want the procedure?
No, they give you a stack of papers, and you fill them out like you've been counseled. Just sign a date. I've seen anywhere from 17 weeks all the way up to 21-week abortions, and come to find out, he would abort one fetus, and there was a second one in the uterus. and the patient would never find
He
out.
a missed abortion.
No, that's not what I'm saying. He would do an ultrasound, but you could only see one fetus.
Right.
And on this happened numerous times, where he would like, what the hell, what the heck? And you could tell that the stomach was still up, and he'd start feeling, and he'd realize there was another fetus, and the patient had no idea that she had
twins.
twins.
And so he would abort one?
He would abort both of them. Eventually, yeah, he
Right.
had to abort both of them, because he wasn't going to tell that patient, oh, you had twins.
So he didn't try to charge her more money, or?
Not if they didn't know. No, because that means he would have to tell the patient why he's charging her more money. Yeah, and twins normally meant more money. You would pay a full amount of one. You would put a full amount for one, and then half for the second. Half of the fee. Like if it was $3,000, you pay $3,000 for one, and then $1,500 for the second fetus.
Did you have a lot of twins?
Yes, sir. Yes, sir. We had a lot of twins.
Were the women aborting because they were twins, or just didn't know it until they got there, or?
It was mixed. Some knew, some didn't. The ones that didn't, he didn't see it on the ultrasound, because had he seen it, he'd charge for that second twin. So pretty much, he felt like it was a loss for him because they didn't charge him for twins. So he would be really upset when he do a procedure and they didn't see that twin in the ultrasound.
Because he lost money.
He lost $1,000 and something. There's a lot of things. I mean, from these large abortions, these botched abortions that he was doing, to hurting the patients on the table, to causing some kind of major problem with the woman's, ripping a uterus and not letting the patients know, trying to stitch them back together and send them home with the package of gauze, and then they come back tomorrow so you could pull it out, but never telling the woman, hey, I ripped your cervix. You need to get some kind of special, you need to get that looked at, he would never tell the woman.
How were drugs handled in the facility?
Anybody drew.
Anybody drew drugs.
Anybody.
We came across a lot of people that got hooked on drugs there. One of the nurses that worked there years ago, her name was, she used to write her own prescriptions. And when they finally got audited, and they realized that she was making her own Vicodin prescriptions, they didn't even fire her. And when I came to work, there was one girl who worked the front, and when I got there, she was drawing medications in the back. I was like, why are you drawing medications? I was just helping out. She was high as a bat. And we dismissed her. I told them she had to go, because she couldn't be allowed to be there because she was high.
You remember?
Go ahead. I'm sorry. Go ahead.
Yeah, you remember when I don't know who was it? It was or who it was that used to take the medications that we used to put in the little envelope, and we used to count them. We used to put them in the envelope.
Oh,
And she's
The Ativan? The
Ativan, yes.
And we gave Ativan, the Ativan, and what else? What else did they used to? He used to. All medicine was pre-drawn. Your Nubane and your Phenigrin was pre-drawn. If you had
Now,
20,
what does that mean, pre-drawn?
Pre-drawn, that means it was drawn a day in advance or that morning, and you're not supposed to do that. You're supposed to draw as you go. And one time when the inspector came, I remember the nurse, she took all the medication that she had pre-drawn, from lidocaine to your narcotic medication. She took them in those little basins, and she ran and put them in the trunk of her car so the inspector wouldn't see that they were pre-drawn. And one very popular thing that he did was there was a bottle called betadine bottle. And this bottle sat on top of the vacuum machine and was the bottle that I would grab to spray inside the cervix and put it back with every patient. And he would grab that bottle sometimes just desperately. While I'm sitting there cleaning the room, he would grab the floor, he would grab the bottle and hold the cervix, the labia down, and spray inside with the sterile glove and put it back, and then he'd take that hand and
Put it in there.
inside the cervix
He
with that
uses-
same dirty bottle.
He'll use the same hand and come and shake your hand.
Same dirty bottle he used on the previous patients. That was one of the, or he would use, like he would open sterile instruments, and if he didn't use, let's say, 4 of the Hawkins or the
Dilators.
They're dilators. They're big dilators. he would grab the little, with that sterile bloody glove he had, he'd grab the little gauze and touch the dilators and push them to the side because they hadn't been used. So he could probably use them on another patient. And he would tell you, don't get those dirty. Put them down there for the next patient. Or if he opened a sterile, like if we opened a sterile sofas or beards and we put them on the tray on top of the instruments, and if he didn't touch that one for the procedure, he'd pick up that little gauze and grab it by the thing, and he'd tell us to open the bag, and he'd push it back in the sterile bag, put that on the tray for the next patient. That was his technique for sterilization. Instruments were never soaked the way they were supposed to soak. 9 times out of 10, the clinic helpers that were in the sterilization room had no idea the proper way of sterilizing instruments.
Did you ever see a situation where someone's come in, paid cash, paid $500, whatever amount it might be, and then the chart was thrown away?
A lot of charts were missing. We don't know what happened to these charts.
Right.
They were missed. The nurse would actually take charts home to sign them.
She still does.
She takes chart. I actually reported her to the nursing board. She gets paid under the table because she receives a Social Security check. So he pays her under the table. He'll give her an amount on a check just to say, yeah, she works here, but he pays her the rest of her complete income under the table.
Is that in cash or in another
In
check?
cash in an envelope, and we've all seen the envelope when she gets it. And another thing is that she does not, like I said again, she doesn't work at the clinic at the errands, and those are the charts she takes home to sign off as the nurse present that day of the abortion.
So,
I have that on tape. I have the charts on tape where she
You
didn't
have the
sign
pictures
off.
too.
I'm supposed to have pictures, yeah. I need to look for them. I really
Okay,
do.
so she's supposed to be on duty,
And
but
she's
she's not.
Correct.
Right.
And then somebody gives her the charts to take home and
She
sign.
comes
She
over
comes
to
and get
the
'em.
location and she picks up boxes of 2 or 3 months behind charts that she has to sign
And
off.
signs, and she's signing that she was there when she wasn't.
Exactly.
Correct. And that's every day.
We had an inspection on the 14th of April, and the inspector, as the inspector was there, she was in the office where this board sits, and she was behind me. I sat on a desk. Inspector was behind me, and she was in another office signing away on the charts in that office, trying to catch up. Yeah.
And she's not present.
She's not.
No.
So your argument would be that they're paying her, she's signing charts claiming she was there, which is she was required by law to be,
Right.
Right.
but she wasn't there,
Correct.
and then she's on Social Security, and he's paying her under the table
Right.
to avoid her going over on her Social Security.
Correct.
To do her a favor, to keep her as an LVN.
She was a Hispanic lady. I want to say she was,
Mexican.
how many weeks was she? Was she past 20?
Yeah, she was.
I think she was past the 24 weeks. And she said, look, I have the money cash. Like, I just want to get this done. And he was trying to pull out the fetus, and as he was putting it in, he pulled her cervix, thinking it was,
Part of the fetus.
it was like an arm or something. So he started spraying the betadine because it was bleeding so much. Her cervix was bleeding so much, and he said, "Damn it! I pulled out her damn cervix. How did I do this? It's because y'all not giving me enough room to see in there. You see, she's already her cervix is so tight." And he was so mad. He was so mad. He started throwing stuff everywhere, and he was just going crazy.
Yeah, she was ready to quit that day because she called me pissed off.
Okay, but he had actually pulled her cervix out.
Yeah.
He pulled it out. He ripped it apart.
And wasn't going to tell her.
And he had said himself, he said, this lady, she probably won't be able to have kids anymore after this.
Yeah, but she was not. And he didn't want to tell her because it was a Spanish-speaking lady.
He felt because she was Spanish, she was just
He-
stupid
he-
anyway.
yeah.
What,
She didn't need to know
what
what
can
was
she
going
do?
on with herself.
What can she do? And it was told her to go to the hospital,
Yeah,
right?
Crystal told her
It
to
was-
tell her,
I
and
talked
then
to her and I told her, you need to go to the hospital. She was in so much pain. She didn't know what happened to her. She didn't know what they did to her.
Because it's normal for them to have pain after the procedure, but not excruciating pain, just some cramping kind of when you have a bad cycle.
Well, yeah, if somebody pulls your cervix out,
Oh, yeah.
it's going to be painful.
Mhm.
Wow.
And I don't think he knew how to sew that lady up, because
He doesn't.
it looked like somebody just got up the other piece of her cervix and just stapled it on her.
And so a lot of, we've seen a lot of cases where women would have to, they felt like they had to push and they had to run to the bathroom and stuff. And on some occasions we had women that were, the fetus were falling into the toilet, or they were, or before even getting to the clinic, we had one incident where it was big news where the fetus was left in the toilet. I don't know if y'all heard of that one. She was at McDonald's. They stopped there in the morning and the fetus was left in the toilet, and nobody ever found out whose fetus it was, but it was one of his patients. We knew it because we were watching it on the news that day that she was supposed to be in the clinic. And she still came to the clinic, and he did, I guess he called himself doing a DNC, and that was it. I mean, you know, fetus born, and nobody said whose it was or anything. It was just a hush-hush thing. He would leave a patient on a table 45 minutes with her legs open and a speculum, and it just sounds funny. It's just, my gosh, with a speculum inside her cervix as he went across to his office and had his sandwich. And we'd be sitting there with the patient having a conversation about her life, and I'd sit in the stool and talk to her, and they'd say, oh, I'm cold, I'm getting a breeze, and I'd cover their legs, you know, because they were open. Or sometimes I'd sit in front of the patients and I'd bring their legs with the instrument still in there, and I'd bring gently their legs and put them on my knees so their legs would fall asleep a lot of times.
That was an everyday thing.
This was every day. After the procedure, the women would still be asleep. His method of transporting them to the recovery was slamming them in a wheelchair. He would pick the patient up and slam them in the wheelchair. Mm-hmm. I'm not talking about gently put the patient down. I'm talking about slamming the patient in the wheel. I'm talking about just the patient just falling while you're asleep. And it was just, it is, especially if you were a big girl, he would let, from wherever he was, he's a tall man, from wherever he had you up in the air, you would fall into that wheelchair.
And if he had a patient that asked a lot of questions, he'll prefer for them to be put to sleep.
Yeah.
Oh, really?
Yes.
In a smaller procedure, that is.
Smaller procedure. It doesn't matter if you're 4 weeks.
Yeah, if they ask too many questions, they say, well, she's going to be in a lot of trouble, so she needs to pay to get put to sleep. Right. Any little comment that she would make as far as if you were on the table, it was his way of making more money, of course, because deep sedation meant dishing out another $200. So if you made, is it going to hurt? I mean, this man would walk out the room and say, Deborah, go talk to her, tell her she needs to get put to sleep. And normally it was our job to go convince the girl that she had to get put to sleep.
Did you ever hear of or witness a patient being sexually abused or sexually assaulted or raped?
I don't know if you would call it abuse, but he had a different demeanor when he felt attracted to a patient. Body language would change, and if I was in the room, me and the assistant would go, you know, like we knew that he was really attracted to the stripper type. Well, I don't want to, you know,
right,
I don't want to be pointing out, you know, talking about people, but a nice tan body where you could tell that the woman's had some breasts done. Sometimes while they were asleep, he would lift up the gown and see their breasts, to check their breast out, to see, you know, the work that she had done on her breast, or if she had any scarring. He'd normally pick it up and look, and, you know, and he would say, oh, those are fake. Or if they were good looking, you know, ladies, especially the white ladies, he would, the whole touching was different. You know, the jamming of the instrument wasn't as
more delicate.
It was more delicate, you know, the putting his fingers in their uterus was different. It was just gross. It was different. You know, you can tell. We're women. We can tell, you know, when someone is touching you in a different, you know, manner.
Right.
And yeah, that went on a lot. A lot of his whole personality would change, and he would treat them a lot better and stuff. He had a lot of favoritism towards patients that were pretty and, you know, nicely made up or smelled good, you know.
As we told you earlier, this segment is an interview Renee and I did with Sophia Martinez, a recent customer of this abortion clinic. She had gone there for an abortion that was to be performed using the so-called abortion pill RU46. At Life Dynamics, we know that the abortion industry is using this drug in ways that do not match the protocol under which it was approved by the Food and Drug Administration. For example, It was originally approved for use in 600 milligram doses, but in order to increase profits, these abortion clinics are now routinely giving it out in 200 milligram doses. Of course, this increases the possibility that it will not work. After Sophia's abortion, she began to suspect that she was still pregnant, although the abortion clinic staff tried to convince her that the RU46 had worked and that this was a new pregnancy. Sophia knew this was not true because she had gone for a free sonogram that was offered by a local pro-life coalition, and it confirmed that she was over 14 weeks pregnant. When the clinic staff learned of this, they panicked. They knew that they had given Sophia so many pills that her baby could have problems, and they also knew that they could be looking at a gigantic malpractice suit. So they began to pressure Sophia to come back for a surgical abortion, which she made clear to them that she did not want. They were calling her constantly and even calling her past midnight. They even sent the abortionist wife to pick her up just to make sure that she made it in. It's also interesting to see the obsession these people had with making sure that Sophia had the money to pay for this second abortion. They would be the ones being bailed out, but Sophia was going to be the one picking up the tab. And like Renee stated earlier, we deal with these women all the time, and the bizarre story you're about to hear is not at all unusual. Now, when you had your abortion, how far along were you?
I was barely 4 weeks.
4 weeks. Okay, now this must have been then a RU46 abortion?
Yes.
Chemical abortion?
Yes.
And then you had some problems as a result of that.
Yes.
What type of problems ensued from that?
Okay. I went in there around December, and when I did the ultrasound, they said that first they could see the placenta being formed, but they couldn't see the baby inside of it. And then he gave me a pill when I was in the office and gave me something to take home. I took them. My period started, like, I was spotting here and there, but I wasn't like the way he said I would be. He said I would like have heavy flows, and I hadn't had one yet. Then I went back to him for like a regular 2-week checkup, and come to find out they had scheduled me for the wrong date. They scheduled me too early. But they went ahead and seen me. That I went to one clinic, and I had to go all the way to another clinic because that clinic wasn't even open that day. And
these were both abortion clinics owned by Karpen?
Yes.
Okay.
One was on Shepherd Street, and the other was, I forgot, Chimney Rock. The other one was on Chimney Rock. And when I originally went, I went to the one on Chimney Rock. And when I went for my 2-week checkup, I was a week and 4 days. I wasn't quite 2 weeks after the procedure. And they wanted me to cancel, but I told them, like, it's hard for me for transportation and having somebody watch my son. And so they were willing to send me to the other clinic. I went to the other clinic, and she had told me that they took a pregnancy test. They were supposed to do an ultrasound, but she said because the line was faint, she said for me to come back. And she gave me some more pills at the office. And then I left, and I took the pills. I came back. She scheduled me for 4 days later. It was supposed to be a week later, but she scheduled me for a Thursday. And I went back, and they told me that the test was negative. I asked them about doing an ultrasound. They told me there wasn't one needed, that I didn't need to have one done because they usually do give ultrasounds, but because I came back a second time, that it had to be done. And she gave me some more pills. I asked her what they were for. She said just in case I had anything else left in my stomach, because she said those pills weren't intentionally supposed to kill the fetus, but they were supposed to just flush out whatever I had in my system. That was the pills that they were giving me before. She said there was only one type of pill. It was a pill when I first came to the office on Chimney Rock. It was the only one that was supposed to terminate the pregnancy. The rest of the pills that they were giving me were supposed to just flush out my system. And I didn't question her.
But they told you weren't pregnant at that time?
She told me I wasn't pregnant. I sat on the seat. She looked at the pregnancy test. She came over and she said it was negative. She told me it was negative.
But anyway, they told you weren't pregnant, but they still gave you a pill to take?
Yes, they gave me 4.
4 pills?
Mm-hmm. Altogether, I had over 12 pills.
Right. Okay, now what happened after that?
I continued. I went home, and on the way home, I thought I had started a heavy bleeding, but it was just like, it was like a whole bunch of fluid, like water, slippery water. It had like orangish color to it. I called them. They said it was normal. They said it was part of the rest of whatever was inside me. It was finishing coming out. Then this was in January. So February came around, and I believed I was pregnant again, because they told me that if you had sexual intercourse right after, it's a possibility. So I called them and told them, and she said that there's no possible way. And I told her, I was like, well, I took a home pregnancy test. I have it right here. So then she told me to come see her. And I asked her, how much it would be just for me to go in for them to check up and do an ultrasound, because I wanted to see for myself that everything was okay. And she told me they went from saying $150 to $75. It would cost in between there, and I told her, like, originally I paid $75 for it, so how would it jump up to, $150? And then I asked her if this was included as a checkup, because they said that if I needed to, I can come back just to make sure, because I was arguing with them with the fact that they didn't do an ultrasound. That was required. That's what Dr. Karpen said was required. He said I'd go to my 2-week checkup, and I would have, if I had any complications before, he said I can come back, and they would do another pregnancy test and do an ultrasound then, and they still hadn't. So I called around other places to look for a cheaper place for me to go get an ultrasound done and a pregnancy test done. So I called Planned Parenthood, and they told me they could get me in there for $100. So I was on my way over to go see them. This is around the 18th February, because that's when I can get my appointment. And I was on my way, and I saw this coalition bus sitting outside of Planned Parenthood. So as I'm pulling in, they're telling me, well, we can do free ultrasound, free pregnancy. I'm like, wow, that beats $100. So I pulled out of Planned Parenthood, pulled to the side, and went into the coalition bus.
The point is that you thought you were still pregnant.
Yes.
And it turned out you were.
Yes. With the pregnancy test, I knew it was a 50-50 chance between it being a new one and an old one, but my body kept lingering more towards the old pregnancy.
Okay. So what you now believe, and eventually found out, was
questioning it.
This was the original pregnancy.
Yes, I was questioning it very highly, that it was very possibility that it could be.
Okay, now what happened as a result of that? How did that pregnancy turn out?
We did an ultrasound, and she was asking me, like, when's the possibility I could have got pregnant this time around and the last time. And I proceeded to go into the story about how I just came from an abortion clinic a month before. And she measured the baby, and she told me that I was 14 weeks and 4 days.
And so now you know it's a continuation of the first pregnancy. This is not a new pregnancy.
Yes.
Is that right?
Yes.
Okay. But again, then what transpired as a result of that pregnancy?
I left the office, and I called them. I called Karpen's office, and I told them that I was, and they told me that it was new. It was a new pregnancy, and I told them that I went to a coalition bus, and I got seen, and I have pictures and proof that it's the same pregnancy, that I was 14 weeks and 4 days, and at that point they told me I needed to come in immediately, and I told them, I was like, well, I need to find a ride, I need to find a babysitter. They told me, I asked them what was going to be done, what was wrong. He said it was a possibility that it could harm me, or my unborn child could be harmed.
That what could harm you?
The baby being inside of me, if something's wrong with the baby. And I started crying, and I told him if I was going to be okay, and he told me to think about my son. That because I told him I was going to go to the hospital. If something was wrong with me, I was going to go to the hospital, that I didn't want to come back. I was mad. I didn't want to see him no more. I didn't want to go back there. I was really hoping it was a new pregnancy. And he was telling me that, that I needed to come in, because not only could it harm myself, but he needed to know if the baby was fine too. And he reminded me of the pills I had taken also. And he says that once you take them pills, you have to finish off what you do. So he said I had to finish the procedure.
So you went back to Karpen?
Yes, his wife came and picked me up on the 21st. I think it was like the next day. She came and picked me up in the morning. And
Oh, he sent his wife to pick you up?
they were calling me from not all day that day, trying to figure out a ride and somebody to watch my son and how I was going to get out there and exactly what they're going to do. They told me that I asked them if, if the baby was okay, that I couldn't do I was mad. I told them, I said, the reason why I paid you what I paid you and why I went in so early was because I couldn't handle getting a surgical abortion done, especially so far along. I told him that I was angry with him because I heard my baby's heartbeat and I seen the baby moving. I seen the baby kicking its feet up against my uterus and moving its hands like this. And I told him, I said, I don't think I could do that. And seeing what I seen, I don't think I could have anything surgically done. I couldn't do that. And I told him, like, it's the big difference between something that's 4 weeks versus something that's 14 weeks. My child didn't have a heartbeat at 4 weeks. I wasn't able to move around, or I didn't have the fingers that I seen or the toes that I seen. And I told him, I was like, I mean, what messed me up the most was hearing that heartbeat beat. And I told him that at that point, if my baby was fine, that I didn't want to do anything because I just...
Okay, so what happened when you went to Karpen?
When I went into him, I seen him, they did an ultrasound. They went straight, did an ultrasound immediately. He asked me for the documentation, and then he shredded it. And I'm like, okay. Like, that was weird, but okay. And then I get to the back, and I'm laying down in the bed, and he's looking, and I heard thum thum, and then it stopped. I heard the beginning of a heartbeat, and it stopped, and he told me that the heartbeat was really low and that my baby was going to have deformities. And he said that the baby had to go. And when I went up to look up like this, he said, lay back, lay back. So I laid back like this, and he continued to look around, and he had the screen. The screen was this way. He put the screen that way.
He turned the screen so you couldn't see it?
Mm-hmm. And he called the girl back in.
And did he then abort you at that point?
No, he told me, he was like, what's gonna have to happen is you're gonna have to have laminara done. He was like,
And this would be a 2-day procedure then?
yes. He was leaning towards 3 days, but then we got to talking about how I didn't think I would be able to come back that many different times and have somebody watch my son, and I just didn't think it was possible. And then he said, since you've already had a vaginal procedure done before, he said that you'd only have to have a 2-day procedure because I had a vaginal birth. And he was like, he said that they'll get placed in, and then I'll come back, and he'll take them out, and then that's when he'll do the procedure.
And then what happened?
I went downstairs, and
Now wait a minute, this is after they've put the laminaria in, supposedly?
no.
Oh, okay.
I went downstairs because, you see, when I went to go pay, because Miss Karpen, she kept asking me about paying more for the procedure because now I had to get it surgically done. And I was mad because I felt like I shouldn't have to, because he told me that if there was a chance that the procedure didn't take, that they would either give me more pills or they had to do surgical. But he didn't say anything about having to repay more for it or anything like that. So I was mad. I felt like I shouldn't have to pay none. I felt like it was their mistake, and I kept asking, or I kept telling, because I got an argument where I was on the phone arranging to get a ride that night, because they called me up all the way from, was 12:45 at night. They were calling me from the doctor's office.
Okay, but wait a minute. At the abortion clinic, he's telling you now you're going to have a surgical abortion, and they're going to have to put laminaria in you.
And I had to pay more.
But you had to pay more first before they would do it?
Yes.
Okay, did you go down and pay more?
I argued with him at first. Okay. And I told him that I was going to go. Like, I'm not going to pay for this. I'm just going to go to the hospital. He told me the hospital wouldn't do anything for me, that they don't do them type of things, and that they wouldn't work on me. and that it can cost me my life. So
He said it could cost you your life?
he said having a fetus inside of me that wasn't, he said it had different maladies, and he said that the heartbeat was low and that the baby would eventually die too. He said having a dead fetus inside of me could kill me.
Okay, so now he's saying you need to have this second procedure. He's wanting you to pay for it. You're arguing about that.
Yes.
Okay, you did not have the laminaria at that moment? At that
No.
point?
No, I didn't. And the lady, when I finally caved in and was like, all right, fine, I'm gonna pay for it, because the doctor's wife, when she picked me up in that morning, she proceeded to tell me too, like, you know, make sure you have the extra cash on you just in case. You know, and she kept pressing it, like, make sure you have this amount. And she kept changing her amount. She went from saying that she was going to give me a deal. And she said, a deal. She said, I'm going to give you a deal because, you know, everything that you've been through and how far you are. Because I told her that I needed money for rent, too. And that I didn't really have the extra cash like that. And she went from proceeding to saying that I had to pay $75 more. And she went up to $100 and all the way up to $300 and then dropped it down to $250. And she kept making sure, like, do you have it? Do you have it? I'm like, yes, I have it.
So you had the $250?
Yes, I had it. And when we got there and I proceeded to pay for it, I went downstairs to pay for it. And the Hispanic lady that was in the original office, the office on Chimney Rock, and the one that I had paid for too, because I had them, they wanted me to pay $10 when I first went back for the checkup. They wanted me to pay $10 for the pregnancy test, but because it came up, how do you call it? Like how do you say, faint? Like the line came up faint. She told me I didn't have to pay for it. She told me they were redo when I come back again that following week, that they were doing another pregnancy test, and then I'll pay for it. And then when I came back and I did it, and they told me that the test was negative, I proceeded to pay for the pregnancy test, but I didn't have change. She didn't have change. So she kind of like rushed me off, like, that's fine, you know, like, you don't have to pay for it. And then when I came back and seen her next time, I was giving her the money, and she told me in Spanish, she was shoving the money away from her. And she told me that they made mistakes there before, and she said she was sorry, and she said let them fix it. Let them pay for it. And I was like, and I told her, I was kind of a little shocked that she was acting like that. And she kind of spooked me a little bit. And I'm like, no, it's okay, I got it. And then she was like, no. And I'm like, no, she knows I have it though. Like, the doctor knows I had it. Like, she made sure it was clear that I had it before I even jumped in her truck. And then and it makes me look bad. Like, I finally get here and all of a sudden I don't have the money. Like, that's gonna make her mad because she specifically made sure it was clear that I had that money on me. And for me to come back just makes me seem sneaky. And I didn't want to cause any problems. So I was like, I kept telling her no, and she kept telling me in Spanish, like, déjala no dinero, like, tell them that you don't have no money. And then I was like, okay, you know, I mean, I could use the extra money, okay. And then she kind of talked loud, and she was like, so what you mean so you left your wallet at home? All you have is $100. And I'm like, no, I had her. She was like, she was telling me, like,
She's wanting you to go along with it.
Yes.
Right.
And I'm like, yes, I left it at home. And then right away, Mr. Karpen came in, and she was like, you told me you had it all. She said, I asked you if you had the money. You said yes. What do you mean? And then I'm looking at the lady like, see, this is what I didn't want to, I didn't want this to happen. And she was like, well, how are you going to have it? And I was like, well, I left it at the house, and when my ride comes to get me, I'll make sure they stop by my house and pick it up, and I'll have it when they come pick me up. And she's like, well, the doctor's not going to want to work on you if you don't have it. And I'm like, I'll have it. And she was like, okay. She was like, because you told me that you had it on you. And I was like, I'm sorry. I was in a rush. We were running late. My son was crying. I got distracted. I'm sorry. And she was like, okay. And she leaves the room, and the receptionist proceeds to tell me where I have to go, like to put the gown on and to sit and wait. And while I'm leaving, she was like, and I told her, I said, I'm just gonna give it to her. And she's like, no, she's telling me no. And I'm like, she's gonna get mad. Because I just told her that I was gonna have it. I already told her I had it. I'm just gonna give it to her. And she kept telling me, no, don't give it to her. And then I'm like, okay. So I'm sitting in the back and I'm waiting, and while I'm waiting, they told me it was gonna be an hour wait. And they had me put on a gown, and had me put these little, I don't know, weird looking underwear on, and there was other girls back there with me, and we're sitting in these recliner seats, and we're watching TV. TV's off to the side. She comes back in, the receptionist comes back in, and she's like, remember, don't give it to him. Don't give it to him. I'm like, okay. Well, the lady comes back in, and she's like,
Now, which lady comes
the
back
wife.
in?
The wife comes back in,
Okay.
and she asks me, like, did you get a hold of your ride? Are they bringing it? So, he's not going to work on you. He doesn't want to, he really feels uncomfortable unless he has the money, like, basically she's saying, like, it's getting to the point where he's not going to do it until I have the money. Like, he's not going to wait. He's not going to do it and then wait for me to have the income.
But wait a minute. Now, at this point, though, he's already told you that your life is at risk if he doesn't do this procedure. But now she's telling you if you don't have the rest of the money, he's not going to do it.
Right.
So that's where you are now.
Yep. So then I had the money on me, though. I had it on me. I just I felt regrets of even acting that way. Like, I just wanted to throw it to her and just say, just do it. Because at that point, she was coming in on and off just reminding me, like, did you call your ride? Do you have the money? Are they going to have it? And I'm like, I was getting kind of tired of her coming back and forth down there to remind me. And
this is Karpen's wife that
yes,
keeps doing this. Okay.
Yes. And then she told me, the last time she told me she was going to call the cops on me if I didn't have it. She was like, don't have, because finally she got to the point where she was like, all right, well, he's going to do the work on you, but you're not going to be able to leave here unless you have the money. I will call the cops. So at that point, I was like, oh my gosh. The other lady came back in, the receptionist came back in, and I'm telling her, like, she's said that they're gonna call the cops on me if I don't pay. And she's like, they can't do that. She's like, this is their mistake. They made a mistake. They didn't want no one to know they made a mistake. That's why they got mad at you for going to the doctors. Because Karpen's wife, when she was on the phone, we were making arrangements, she had asked me why I went to go see a doctor. Like, why didn't I go back to her? And I told her because I was like, I don't feel comfortable, and I was mad at you guys. I didn't want to come back here. Like, I thought it was all a nightmare.
Then they go ahead and put the laminario in you?
They called me, they had me drink this little black stuff. It was in a cup. All the females had to drink it. And he told me it was to open up my cervix so that way they can stick the laminaria in there. And so I drank it, and then I get to the back, and he's putting something in my arm. And I asked him what it was for, and he said I was hyperventilating, because I was shaking and I was crying. And
he told you it was what?
He told me it was fluids because I was hyperventilating.
Oh, I see. Okay.
And then he put the mask on me and turned the thing up and told me to breathe in, and I started shaking even more and started crying even more, and he kept just telling me, like, breathe deep and inhale. And I was like, what is this? And he was like, it's just to help you fall asleep. And I was like, okay. And then I remember looking at the clock, and then I remember he turned the gas off because he was like, the wife came in and reminded him to have me call for my ride to make sure I had the money. So he turned the gas off and took the mask off of me. And then he was like, oh, you need to call. And I told him that my phone was in the locker. And at that point, I was kind of nervous because I went and I pretended like I called. Because I already made up my mind I was going to give
You
him
get off
cash.
the table?
No, I sat up from the table.
Okay.
And they handed me my stuff in my locker. And at that point, I just act like I made a phone call. Because what I did was, I didn't want to be asleep in the back room and they found out that I had the money and then questioned why I was lying about it. So what I did was, I texted my friend of mine and told him where I was at. And then I took the money that I had and took my battery out the phone and put the money where the battery was and closed the phone. So when they brought me my phone, I didn't want them to see that I took the money out and tried to put the battery in. So I proceeded to act like I made a phone call. And then he said, okay. He was fine. He walked out. The ladies were in there, and the ladies were in there talking about, one of them was saying how she had to get more medication from the doctor, that her back was hurting. She was talking about, because they never called him by his name. They never called him Dr. Karpen, they just called him the doctor. And the lady was saying something about how she needed some more stuff for her asthma, and she was wondering if the doctor would give it to her or not. And another girl was saying, why not? He gave it to you before. And then I had the mask back on me. They took my stuff back to my locker, and I kept the chain around my wrist. And I fell asleep. I looked at the time. It was almost 12:20. I woke up at 2:24 in the chair. And I was like, I woke up kind of like, I jumped up, and they came in, and the lady was watching me, and I felt really sick, dizzy. I couldn't see very clear. Everything was blurry. They could tell me to calm down. I asked them what had happened, and they told me that they had just got done putting the laminaire inside me. And when I stood up, I was like bleeding, but bleeding clots, and I asked them why I was, and they told me it was normal. And they told me to hurry up and get dressed, and they had asked me about my ride again. And I told him that, that he should be coming. They're like, well, it's 2:20. And I was like, well, I told you he'd be here between 2:20 or 3 o'clock. And, it was nowhere 3 o'clock yet. I mean, it was 2:20. So he had plenty of time to get there. And she had asked, one of the ladies, the receptionist that had called me to make the plans for me to get back and forth, because she had called me at night. I talked to the doctor's wife in the morning about how to get directions to get to my house. And I talked to night about making plans to get there. Had came in, and she had asked me for the number. And I'm like, what number? And she was like, the number for your ride. She was like, let me see your phone, I'll call him. And I was like, well, he doesn't have minutes, you have to text him. She was like, well, I'll text him off of my phone, give me the number. And I'm thinking that's kind of like invading privacy. I felt kind of like a little violated with that. Like, it kind of bothered me a little. And I went ahead and gave her the number, and I was like, look, my ride's coming. They know that I'm here, but they don't know like exactly what I'm doing here. They don't know into detail, so please don't go into detail about why I'm here. She's like, was this the ride that's gonna bring you your money? And I'm like, yes. She's like, well, that's all we're gonna ask about. I'm like, okay. And I gave him the number, and I sat in the back and for a minute, and then she came back, and then she was like, oh, you can go ahead and get dressed. And she asked me for the key. I handed her the key so she can give me my stuff. And I went in the back and got dressed, and I came out. She said, we're gonna take the IV off of you too when you get out. And I'm like, okay. Well, as I'm sitting there waiting for them to take the IV out of me, I started dozing off again, and I felt like I wanted to throw up again. Like I felt like I was struggling. Like I was trying so hard to come out of being drowsy. And just like, cause like when I got up to the bathroom to go get dressed, I almost fell forward, and the lady had to grab me. And I felt the same way, like when I was getting dressed, I couldn't, like I sat there for a minute and I forgot why I was in the bathroom. And then like I was shaky when it came to put my clothes on. I just didn't feel right. And I'm sitting down at that point back in the waiting room, and they told me that I couldn't leave unless my ride came here. And I was like, well, can I go outside and meet up with them? And they're like, no, he has to come inside. I'm like, well, he has my son, and you said that there's no kids allowed in the lobby. And she was like, so she went to go ask the doctor. And then he said that if I tried anything funny or if I didn't pay, he was gonna have his wife kick my ass. And I'm like, oh, wow. I was like, are you serious? Like, it kind of spooked me a little. I was like, why would he say that? And then I was like, yeah, I'm gonna give him the money. I'm definitely gonna give him the money. Because at that point, I was like, it's not even worth it. It's trying to save an extra few bucks. It's not even worth it. I mean, she knows where I live at. She has my address. She knows my cell phone number. If he's over here talking about he's gonna have his wife beat me up or whatever, I'm a non-confrontational person, so I don't fight. So I'm like, okay, whatever, I'm gonna go pay for it. So I took the money out, my phone, I had it in my hand, and my plan was, when I go out there, I'm gonna walk up to the window, I'm gonna tell him like, okay, well, you need to help, we need this much, da-da-da-da, I need you to give me this much. And then when I would do that, I'll just toss him the money, and then he'd just hand it back to me as if he's giving it to me. That was my plan. Well, I had my original seat set 150, and when we were going outside, they're like, doctor, as I'm walking past, the doctor said, keep an eye out on her. Don't let her go nowhere unless she has that money. And I went like this, and I looked at him like this, and then I walk out in there, and walked me all the way to the car window. And I just leaned over the car window and explained to him like I needed it and tossed it to him, and he gave me the money. And she stood back there, and then she told me, she was like, oh, we're gonna need an extra 20. And I'm like, I'm only paying $250, I already paid $150. And I was like, well, I don't have the change. And she was like, well, that's fine, because she said something about a receipt. And then because she was like, do you want me to write another receipt out? And I'm like, yes. Oh, she's like, oh, we can send it out in the mail. I was like, no, we can. I said, we can go ahead and write it out. I'll walk back in there with you. And then when she said something about how she needed another 20, I was like, well, I don't have change. I said, if you want the other 20, we were definitely gonna have to go back inside. I said, that makes sense anyway, so then instead of mailing me my receipt, you could just hand me, rewrite it out again. And then she was like, oh no, that's fine, never mind. And then she took the rest of the money from me, and she was like, I'll mail you a new receipt out.
Okay, did they ever mail you a receipt?
No.
Okay. Now, did you come back for the abortion procedure?
The way home, on the way home, like I said, I was still drowsy a little bit. I got home, and I took my coat off. When I took my coat off, I felt like a little pain, and they had left the IV inside my arm. And I called, and I didn't get no answer. And I called again, and it was Chimney Rock's location number, and it transferred me over to Shepherd. And told me to meet her at a park, and that she would take the IV out of my arm.
Told you to meet her at a park.
Uh-huh.
And she would take the IV out of your arm.
Yes.
Now, was a doctor?
She was a receptionist.
Okay. Did you meet her at the park?
No. I went to the hospital. I thought that was kind of weird. She told me, she was like, does anybody know you have the IV in your arm? I was like, no. She was like, and I told her, I said, I'm gonna go to the hospital and take it out. And she was like, no. She was like, if you don't feel comfortable at the park, I can go to your house and take it out. She was like, is your son there? And I said, yeah, he's here. And she was like, well, then maybe we should just go to the park. And I told her, I was like, it's getting kind of, cold outside, and my son's a little hungry. She's like, well, you can feed him. And then call me when you're ready, and meet me. Is there a park nearby your house? Is it close? And I'm like, yeah, there's one up the street, like 2-3 blocks down. And she's like, well, you just meet me there. I was like, no. I went to the hospital. They told me I did a good thing by going to the hospital. When I got to the hospital, they're getting ready to, the lady was like, there was a lady that was cleaning up. She was like taking the garbage out and stuff. And they were talking to me about what I was there for. And I told them, like, I'm here to get this IV out of me. And they're like, whoa, who got the IV in you? Like, where'd you come from? I'm like, a clinic. And they're like, what's in your IV? And I'm like, oh, it's fluids. Because they had told me that I looked like I was dehydrated too. They're like, you look dehydrated. And they were talking about using that same IV to put fluids in there. But when one of the doctors had looked at it, he noticed it was white stuff inside of the IV. He asked me, at that point, he'd asked me what clinic I came from. And I told him it was an abortion clinic and that I was there to get laminera done. And he said that at that point, when they put you to sleep, it's only supposed to be done with a mask. You're not supposed to have two things. And one of the ladies said that it looked like it was protocol, the same stuff that, her exact words were, the same stuff that they used to put Michael Jackson to sleep that he died from. And I looked at her and I'm like, okay. And she was like, you know, how did you feel when you woke up? And I told her, I said, I felt like I wanted to throw up. It almost came out of me and then it went back down. I told her, I said, I felt dizzy, shaky. I told her, I said, when I woke up, I seen blurry vision for a while. Everything was blurry and watery. And she took the IV and they went to go test it. And then they went and did an ultrasound on me. And they were just like clicking and doing a lot of but they weren't really saying anything. And then the lady said that she couldn't see anything, so she was gonna stick something up inside of me so she can see. And then I told her, I was like, well, wouldn't that affect the laminera that I have in me? Like, wouldn't that push it up there or hurt me? I don't want to get hurt. And she was like, okay, well, we're just gonna do like a pap smear instead, like a swab. And I'm like, okay. And then they came back and they told me that I wasn't pregnant no more and that I had a forced DNC done on me.
So you didn't have laminaria?
No.
And so now you think, I guess you have evidence that what happened when they knocked you out at the abortion clinic is they didn't put laminaria in you.
They went ahead and did the procedure.
They did the abortion procedure.
Yeah. I was mad.
I guess you were.
And I was confused. And I was hurt because I was told that I needed the laminera done because it caused damage down there. And then to find out that I went there, and even though I had agreed to get it done, I didn't agree to get it done that way and that day. I had to agree to get it done as long as I had the laminera done with me, so that way my cervix could be dilated properly and they could do what they had to do. Come to find out, she's telling me, from the looks of it, your stuff is swollen and it's really red and it seems like you've had a forced DNC done on you.
Now this is the nurse at the emergency room.
It was a doctor.
A doctor at the nursing room said you had a forced DNC done on you.
She proceeded to ask me what the clinic was, and she called the clinic and she came back and she said that the doctor said it must have been a misconfusion, a misunderstanding, that I came in there for a DNC. I told her that yes, I did agree to a DNC, but he told me that I had, because how so far along I was, that I was supposed to have a 3-day procedure, but because I couldn't get back and forth, that they were going to settle for a 2-day procedure. The 2-day procedure, there was still going to be some risk that may come with not being able to have kids, but it won't be as mild as not having it done. Because they were really pushing for 3. But because, he settled for 2 and he said, well, you should really get 3, but a 2 day is not going to hurt you.
And then they did it in 1?
They did it in 1, yes.
Okay. Have you had problems as a result of that?
I get pains here and there, like down there, like, I haven't had like normal period yet. Like sometimes I'll bleed for like 2 weeks. And usually my periods are like 4 days. And they go from like a mild to a light. I have heavy periods, and sometimes I don't bleed at all. Sometimes I spot throughout the day. Mostly what bothers me is I cramp a lot. Like, I have like sharp pains, but they're not in the middle. They're just from the side of from my sides, and I cramp, and then they work their way down towards the middle of my stomach. Or like I had a little bit of a UTI a couple weeks ago. I don't know. I just, like, sometimes when I go to the bathroom, like, I can't, like, I have to go pee. If I have to go right away. Like, I can't hold it in like I usually do.
Have you had a OBGYN check you out to see if you have?
I have appointments scheduled in 2 weeks.
Cervical damage or anything like that?
Mm-hmm. I haven't went yet. I have appointments. I just went and got my Medicaid.
Now, I understand that subsequent to all, after all this happened, that you tried to get your medical records from the abortion clinic and were unsuccessful at that.
He said they could be repolished or something. Refurbished?
But
Something.
anyway, you did not receive them. Did you get your medical records from the emergency room?
Yes.
Okay, so
They sent them.
you did have the emergency room medical records. Mm-hmm. And where are those medical records?
I believe they're with the attorneys, some attorneys that are
okay.
trying to help me out with this whole case.
Because I had understood that you had someone broke into your house and stole them or something.
Those, yes, I had to re-get copies. During that time, I went to my friend's house because I was still getting calls.
Okay, let's start over
from
now.
Karpen.
Let's talk about what happened to the original set of the medical records that you got originally.
I took them home, and the day that I went home, Karpen had called me that same day that I was in emergency and asked me why I went to the emergency room instead of not meeting up.
In the park.
Yes, and I told him I didn't feel comfortable. And then he called me again, and it was, and she was like, I told you to meet me there, and she was starting to yell at me about it. I hung up the phone on her, and then I didn't feel comfortable being home. I'm a little scary cat. It's just me and my son. So I went to my friend's house, and later the next day I found out that somebody had broke into my apartment. They went through the window, and they left the knife on the bed, and my medical paperwork, like all my documentation and stuff, was sitting on top of my refrigerator, and that was the only thing that was missing.
Okay, no.
Like, I had a laptop sitting right on top by the window. I had my TV, you know, I had a shoebox that had some money I was saving up, and it had my card in there. It had, you know, just food stamp card. These simple things that I would think that would get taken. You know, my DVD collection on the floor right by my TV. But most importantly, I was like, okay, if this is somebody that was breaking in here, they would have like definitely took my laptop. I mean, it's sitting by the window, the inches where they came in from. And then like I said, there was a knife laying on my bed. It was like stabbed up like this on the bed. So
somebody had broken into your apartment the day of all this happened. And they didn't take the laptop, they didn't take anything, television,
no,
anything.
no.
But they stabbed a knife into your bed and took your medical records from the emergency room.
It was sitting on top of the TV.
Did you call the police on that?
My landlord did. He wanted me to come back and meet up, and I told him that I was like, I'm coming back and getting my things. I'm not coming back there. Like, I'm scared. I don't know anybody, because he was like, do you have any idea who may have done it? And I said, no, I don't. I mean, because I didn't want him to know my personal business about me having that done. But I told him, I said, I don't have no problems with anybody. I mean, I've only been down here for a few months, and I don't know nobody like that besides my friend now. And I mean, I've been hanging out with her. She's not giving me any indication that she's had any problems with me. And I told him, I was like, so, and nobody else knows where I stay at. I just moved in here. And I was telling him, I said, I don't have no clue to who would do that. And I told him, I said, and it seems very random, because he was like, because he had asked me myself, like, because he was like, I think somebody doesn't like you. He was like, and I was like, why? Because I asked him, I was like, is my stuff gone? And he was like, no, your stuff is all here. Laptop sitting right by the window. Your clothes are here still. Your son's toys, TV. And then I told him, I was like, there's nothing missing. He was like, nah. Well, after he made a police report and the incident, I decided to go back to get my stuff. I brought a couple of my friends. My friend and her friend came, and excuse me. And she pulled up. She turned her truck around this way and had the doors open. And our job was just to hurry up and grab what I can grab and get out. And when I did, I grabbed, suitcases and bags and threw my clothes in there and grabbed the laptop, DVDs, and then I went and grabbed my box of paperwork. And it was sitting because I have some of my paperwork, like when I write letters and stuff like that, or old news clippings that I have that I don't want to throw away, or I had that sitting in the closet. So I pulled that out, and I'm like, what else am I missing? What else am I missing? I'm like, oh yeah, my paperwork from the bank. It was on top of the refrigerator, so I grabbed that. And I was like, oh yeah, my other, the hospital paperwork. And I looked, and I'm like, where's it at? I grabbed a chair and looked on the top of it. And I'm like, okay. I looked in the box. Like, maybe I put it in this. Looked in the box. It wasn't there. Put out the drawers in the kitchen. Like, it wasn't there. So I was like, wow.
So all that had happened is your paperwork from the emergency room was gone, and somebody had stabbed a knife into your bed. And did the police take a report on this? And have they found anybody?
No, they said the fingerprints belonged to the person who originally, like my fingerprints, because I left my window open and closed, and then the person who was staying there before, because I moved in a week after the person moved out. So
they have no idea who did this, and that's where it stands now.
Yep. I don't like to point fingers because I don't have proof either, but it just seems weird. Like, you had valuable stuff you could have took there, and you left it there. And then the creepy thing is that you leave a knife stabbed into my bed. At that point, I was like, I'm done. I moved out, and I'm currently living with a friend because I don't have confidence
I wouldn't be comfortable with that either.
by myself right now, and I haven't been back there since, and I don't. And through all this, like grabbing the medical records, they were going to charge me $75.
Now wait a minute, who was going to charge you $75?
Said it was going to cost me $75 to get my medical records. She said that for myself. She said that if a clinic asked for them, that they would be for free. All the clinic had to do was, call. And then she asked me why I wanted them. I told her because, I'm going to see a new gynecologist, and he just wants to know everything that's going, the update and everything that's going on, what happened and stuff. And he was fine with it. One thing though that bothers me the most though is when I went to go see the Dr. Crystal something, I went to go see him, and because I was gonna make an appointment with him just to check to see if everything was okay down there. Well, I had asked him a question that I kind of like deep down inside that I knew, but I asked him I told him I was like, what I want to know is if my child was really okay, did I just do that because he wanted to get it done? Like would I have been able to keep my baby? And he turned around and looked at me, and he was like, I think that's a question that you can answer for yourself. Because I told him that when I went on a blue bus, said that the heartbeat was fine. And when I looked on the monitor and the pictures that I have, ultrasound pictures still, I don't see no different maladies. I don't see anything wrong with my baby at all. I mean, I heard a heartbeat, and I heard one at his office. It was only a day apart. I had seen the pictures from what showed me, and I don't think there would have been nothing wrong with my child, because baby was kicking and moving his arms and moving around like it was on, like, I don't know, like it was playing or something, like the way my son did when I seen my son at 10 weeks. So, I mean, I feel like I just did it for no reason. I feel like I was led to believe that I was mostly concerned about my son because he doesn't have no one but me. And when he said that it was gonna hurt, that the baby was gonna cost my life, and that the baby didn't have a life no more anyways, and I mean, it was either my unborn child's life or my life, and thinking about how it was affecting my son, I thought I was doing the right thing to protect my son, so that way he wouldn't have because he don't have nobody but me. And then, like I said, I honestly, if I had known that my baby was okay, I wouldn't have done what had happened. None of that would have happened. I would have never went in there. I can imagine doing something to a 14-week-old baby that has a heartbeat, that's moving around, that in less than 3 weeks you'll be able to tell what you're having, whether it's a boy or a girl. I wouldn't have done that if I wasn't told what I was told. If I wasn't told that my child was having, the baby was having difficulties, or that the baby wasn't gonna make it, and that my life was in stake, I wouldn't have done it if I would have done. I would have still kept it, because to me, if the procedure didn't take, then it was never meant to have it done in the first place.